Organisations whose operations are global must constantly and consistently plan for normal-sized and extra-large problems, and for expected and unexpected ones. One concern that epidemiologists tell us that we face in the near future is the likelihood of an influenza pandemic. Medical experts believe that the world is now closer to another pandemic influenza than at any time since 1968, when a mild influenza pandemic killed 1 million people. For international organisations, a pandemic presents particular logistical challenges in order to continue with operations while protecting staff. WFP, like many other UN organisations, gives assistance to millions of needy beneficiaries all around the world. The World Food Programme feeds nearly 90 million people in almost 80 countries.
Protective measures for pandemic influenza has been made by the World Food Programme for its staff and family members, for other UN agencies and other international programs, and it is the first in a series of presentations on steps that public health experts recommend for limiting the spread and transmission of infection in a pandemic. For clarification, a pandemic is a disease that breaks out around the world. A pandemic influenza occurs periodically when a new strain of the flu emerges, for which we have little or no immunity and for which a vaccine is not readily available. Additionally, people who have become infected with the virus may be contagious while not showing signs of being sick. It often originates in other animals, jumps species lines, and then spreads easily from person to person. It causes serious illness and can sweep across the country in which it originates. Given the level of global travel nowadays, a pandemic virus could then spread to the rest of the world within weeks to months, leaving little time to prepare. Antiviral agents and vaccines are being developed, but may not be available in sufficient quantities to meet the demand. Other strategies, such as public health measures, can and will be used by everyone to reduce the risk of exposure to the virus. These include hand washing, masks, and personal protective equipment. Furthermore, during a pandemic, local public health authorities are likely to invoke measures that will aim to keep people from gathering, thereby reducing the risk of transmission and exposure. For this first chapter of Protective Measures for Pandemic Influenza, we look at an everyday event, a staff member coming to work in an office setting, but is coming to work during a pandemic. At the end, we'll briefly review what's different about working in this situation. For now, I invite you to watch and simply note what's different.
Hi, good morning, Richard. Stop here, please. And Monica, please stop here. Thanks.
Hi, Rashad.
Sorry?
Annie, please do not take off your mask.
Sorry.
25, front 12.
Go ahead, 12.
Can you send another staff member?
Kobe, you can go inside now.
Morning, Rashad.
Morning, Gloria.
Can you go ahead, take your mask off very carefully. Take it off from behind with the straps. Don't touch the front.
Okay.
And then dispose of it in the pedal bin there.
Right.
And then when you're done, go ahead and use the hand gel to thoroughly clean your hands. Go ahead and just follow the instructions step by step. Okay? That's important. As you're doing that, I'm going to ask you a few questions as a part of the screening evaluation, okay?
Okay.
Okay. Rashad, what's your index number?
88
01010.
Okay. Have you been around anyone that's had the flu in the last 2 weeks, as far as you know?
No.
Okay. And have you been on duty travel within the last 2 weeks?
Nope.
Okay. Good. Everything checks out fine, so
Okay.
you can report to work.
Okay.
Okay. Let me just give you some last instructions.
Okay.
Remember, take your temperature 2 times a day, morning and evening. Record it.
Okay.
If it should be above 37.5, call security. Tell them they need to call medical.
Okay.
Okay.
All right.
And I'll give you this hand gel cleaner.
Okay.
Use it frequently, especially after touching any commonly touched surfaces.
Right.
Okay.
Okay.
Any questions?
No, it's really all clear.
Good. Now you can go. You should take this green card and give it to Elizabeth, the guard who's at the entrance.
Right.
Walter will show you where you need to go.
Okay.
Okay.
Thanks.
All right. Bye-bye.
Hi, Betta. How are you? Gloria told me to give you this.
Thank you. Let me check your name off the list. Here you are. Okay, you're free to go. Please follow the one-way arrows up to the stairs. Remember, in order to get to your office, you have to take the green tower.
Okay. Thanks, Betta.
You're welcome.
Bravo 276 to gate.
Go ahead, Bravo 276.
Bravo 276 to gate. I don't feel well. I've got a temperature. Call medical.
Medical from security. Urgent message, over.
Control room, this is medical. Go ahead, over.
Reported medical emergency location 2, Bravo 7171. Please attend, over.
Control room, this is medical. Copy 2B71. I'm on my way. Over and out.
Thank you, medical. Thank you, over now.
Rishad, can you hear me?
Do they have the blood pressure cuff in the white bag? Thank you. And can you give me the pulse oximeter?
Open your eyes. Okay, I'm going to give you some oxygen to allow you to breathe better.
Let me give you that. Could you just put that out of the way? Thanks, Remo. His blood pressure is 80/50.
Very good. What's the saturation now?
It's 90, and his pulse rate is 120.
Okay, Remo, can you call an ambulance, please?
Gate, from 2B71, we need ambulance service, over.
Okay, Richard, we are going to give you some IV because you are a little dehydrated.
Which way out?
Let me show you. Come this way.
Let's look at the film. In particular, at 10 points to highlight differences between working in an office in a pandemic versus a non-pandemic situation. For a deeper look at some of these topics, review the chapters at the end of the film. 1. There are very few people in the office. During a pandemic, many staff will work from home to limit their exposure to the pandemic influenza virus. 2. Offices that have core staff members coming to work might arrange for transportation with shuttle van, but staff will be advised not to take public transportation. 3. Staff members have been trained on the use of surgical masks in a pandemic, how to put them on, take them off, and their utility. 4. Staff have been trained on how to clean their hands and to do so often. Public health experts have long maintained that hand washing is the single most important tool for preventing exposure to many infections, including the pandemic influenza. 5. Staff are screened for fever and flu symptoms before entering the building. During a pandemic, staff will take their temperatures twice a day. If they have a fever, they will stay home and inform the designated person in the office that they have a fever. 6. The traffic flow through the building is one way only, at least initially, to decrease the likelihood of spreading infection if staff members were to pass by each other. 7. Staff members have hand cleaner, masks, gloves, disinfectant wipes at their desk for easy access. 8. Staff members have radios and have been trained in how to use them. 9. Personal protective equipment is used by personnel who will be involved in certain patient care situations or the transport of staff who are suspected of having influenza. 10. Offices will establish an emergency exit when possible for staff members that need to be transported to the hospital. Working outside of the office will present other situations that will require additional public health interventions. They will be addressed in the next of our film series of protective health measures for pandemic influenza.